Welcome to the Public Health Roundtable Live. Our topic today is focused on breast cancer awareness. This is Breast Cancer Awareness Month, and I'm joined by a panel of entrepreneurs, public health professionals, and experts who will be sharing some insights on this topic and helping to guide the discussion. So I will start with introducing myself in case you're wondering, well, who are you, lady? My name is Dr. Charlotte Huntley, and I am a public health entrepreneur. I'm an epidemiologist by trade, and I'm the CEO of Dr. C.H. Huntley, LLC. We're an epidemiology consulting firm, and we support BIPOC organizations. So our clients are usually large nonprofit organizations that are serving BIPOC communities, so Black, Indigenous, people of color communities. And we support them by helping them communicate their health information in plain language to the communities that they serve. We find that that's one of the best ways to have a great impact in communities. When people understand the information, the data, they can make really good informed decisions. So that is our goal to do. And we are delighted. We're often invited to serve and work with tribal organizations for years. And that has been a real exciting part of what we get to do. Sometimes we show up and we help with customized reports. We do a lot of work with community health profiles, just custom reports to analyze data. And sometimes it's the communication piece with podcast support and with facilitating workshops. It's whatever the needs of the organization are. Relating to the data and communicating that health information. That's what we do. So I am going to pass the mic over to, I'll start with LaShonda. I'll ask you to introduce yourself and tell us a bit about what you do.
Hello, everyone. My name is LaShonda Richardson. I am the founder and CEO of Emerge Public Health and Community Development. Emerge is a company. I'm a public health consultant, and it is designed to educate, to motivate, empower, restore, grow, and evolve. I am a public health consultant. I'm a public health educator that specializes in program planning, in resource evaluation, and in community health and wellness events. I plan, host, and facilitate community health and wellness events. And not just within the community, but I also work with businesses and other organizations, nonprofits, faith-based organizations to provide public health education and program planning. I am also a certified community health worker. So I am working in the community with nurses and doctors and other practitioners to be a part of the healthcare team for the community. So I am super excited to be here today and to join in on the conversation.
Thank you for that great introduction. I'm going to move over to Jessie. Jessie, please introduce yourself.
Hey, everybody. I'm Jessica Hekmati. I'm founder and CEO of a company called Small Ruminant Solutions. And so that's focused on zoonotic diseases, mainly in small ruminants, which those are sheep and goats. There's a lot of diseases, zoonotic diseases that can be transferred from sheep and goats and ruminants in general to humans. And so my company specializes in containing those potential outbreaks, any type of zoonotic disease that we encounter on the farm, and how we can prevent future outbreaks and contain those when we have new livestock purchased. What biosecurity plan can a farm create to keep those outbreaks or those diseases from coming into the farm? And if there is one, how do we minimize that outbreak? I also have experience, close to 10 years experience as an oncology data specialist. So overall, I've just been in the field of public health for a long time now, for my age, I feel, and I'm very passionate about it all. But mostly, like I said, in that zoonotic disease aspect of things.
Thank you for that introduction, Jessie. And Ericka, please introduce yourself.
Hello, everyone. I am Ericka Horne. I am the CEO and founder of Akeri Consulting, LLC, and I have the distinct honor of serving nonprofit organizations, faith-based organizations, quite a few mentoring organizations with event planning, hosting events, wellness events such as health fairs and doing speaking engagements, providing health education in any capacity that's needed for these organizations. I am a certified health education specialist. I'm a public health professional and consultant, been almost 10 years now. I am a certified community health worker as well. So being able to not only help with planning the events, but being a part of that healthcare system as well, to be able to impact not only individuals, but also the community at large. And I get this amazing opportunity to do these things each and every day of my life, and I love it. I'm also a doctoral candidate as well. So I'm working on my Doctor of Public Health degree, which will be ending soon, we pray. And I'm really excited about today's conversation and about the work that I get to do with my business and how I get to support those that I'm passionate about serving. Thank you.
What a great introduction. Thank you, Ericka. And I love hearing, I know all of you, but I get so excited when I hear you introduce yourselves all over again. So I'm excited for this conversation. I am very interested and intrigued to dive into this topic today. Like I said, breast cancer awareness. And I really want to know, how are you having these conversations in your community? And it could be the community you serve through your organization, your business. It may be your community of friends or family. What does that mean to you? You can, be prepared to kind of share your thoughts. We're going to go around the table here. This is from National Breast Cancer Foundation, and it's nationalbreastcancer.org. For Breast Cancer Awareness Month, I always try to look at, what are our statistics? What are our numbers telling us? But for in 2024, more than 360,000 people will be diagnosed with breast cancer. That's a staggering number, but there's hope. I read through, there's so many advances in technology and early detection methods, which we're all public health folks here on this panel, which means we're very focused on prevention. So when we hear that there are these advancements that lead to early detection, that really gets me excited, because as I look at their statistics and a little bit further down the website, when caught in its earliest stage, localized stages, the 5-year relative survival rate of breast cancer is 99%. That tells me, and the way I'm interpreting that is, early detection is key, because if it is at localized stages, early stages, then you have a chance to beat that. And I, I thought about, like, personally, what do I want to share? When I was working in industry and as an epidemiologist in pharmaceutical industry, I did a little bit of cancer epidemiology, and I was actually assigned to breast cancer for a little while. And so I looked at, incidence of breast cancer compared to different countries. But I decided not to even go down that rabbit trail. I made it more personal today. So I'm wearing this scarf. I don't really do scarves, but last year, my mother and my mother-in-law both passed away, and both of them were very big fighters in all their healthcare journey. But my mother-in-law won her battle to breast cancer, so that wasn't the cause of her death last year. But years prior, she's a breast cancer survivor. So when she passed away, this was her scarf that she gave to me. So I'm wearing this today, not just, honoring her, but there's so many women that I know. I have friends, I have relatives that were in that situation where they, were doing their screening. It was caught early. They were able to fight it and, victorious on the other end. So this is sort of a tangible reminder that, there are people that are fighting this. And I'm sure a lot of people, similar situation. So I think for me, in terms of my community of friends and family members, I do often have the conversation, and I allow people to remind me, did you have your mammogram? And we talk about this, because that is so important in terms of normalize. There's still people that are very afraid of any type of screening because they've heard, oh, that's painful, that's uncomfortable. So just having those conversations with my friends and having that be a normal part of how we catch up is something that I do. And when questions come up, I don't have to be the one to give all the answers, but I'm happy to point people in the direction of really robust resources so that they can get factual information for themselves. So I'm going to, in the same order that I did introductions, I'd love to hear from you all, your thoughts around, having this discussion or just around breast cancer Awareness Month and what this means for you. We'll start with LaShonda.
Yeah, so I love that you included statistics in your talk, because I think that that is important for people to know. And in the communities that I work in the African American community. That is who I serve, in low income communities. And so for Black women, we are 40% more likely to die from breast cancer than our non-Hispanic white counterparts. And that is because it is caught in such late stages. So early detection is key. And so when I'm working as a consultant or working in the community, it is important that people know that they're educated, that they know what the risk factors are, and that they know what resources are available to them to be able to combat any fear or anything that they have. And personally, when I went to get my first mammogram, because I had, I was afraid. I was, because of what I had heard, but I allowed my wanting to be healthy and to know, and my life to be to overcome that fear of of me wanting to live and me wanting to know. The magical age or the historical age for women for mammograms has been 40, but a lot of the medical societies are doing research now, because when Black women are get the diagnosis is so late, moving that age up to maybe 30 to possibly being 35. And then you consider risk factors like family history and other things. There's so much conversation about this and so much research that we are currently doing and to be done. There's the talk of genetic testing and just other factors. So there's so many things and so much research and so much information out there that I love getting out and making sure people are aware what they need to do to make sure that they're making the right decisions, that they are going to the doctors. If you're afraid, taking someone with you and not believing, the myths and things of that nature. So when I'm doing events, when I'm speaking about breast cancer awareness, I always make sure that the statistics are included, that people know what they are, that they know what they're up against, but also they know the preventative measures, and they also know what resources are available to be able to assist them in making the best decision for their health care.
Thank you for that, LaShonda. Great insights. I'm going to move over to Jessie. I'd love to hear your thoughts on this topic. What does this mean to you, and how are you having these conversations?
I mean, you guys have said it so well. Screenings and prevention is the key, or what did they say? An ounce of prevention is worth a pound of cure. And I couldn't believe it more when it comes to cancer screenings. My husband's mother died of breast cancer when he was only 8. This was in the 90s. And what's really interesting is how far we've come. Like you get your screenings every year. They almost have it down to a T. When you get it caught early, what you do. It's really cool to see how far we've come with that. But then, like you said, we have so many individuals who aren't aware of the screenings, or they think it's going to be expensive, or it may be expensive, or will insurance cover this? And I feel like individuals, especially when it comes to something as scary as cancer, I feel like we have a tendency, at least I can, like when something scares me, I just want to put my head in the sand and be like, pretend it doesn't exist. But if we can teach the population and educate the population that if you do catch it early, you'll be fine. It'll be okay. Cancer has it's so scary for so many of us. But when we look at it as this, when you catch it early and it's this little thing that you can get rid of and nip it in the bud before it becomes the scary thing that can metastasize and this and that, I feel like it can make such a difference. And it's almost like normalizing it in a way, educating the public that, yeah, this can happen, but you can do this, and this to prevent it from happening. Like I said, I think it's really neat how far we've come, and, just in the last 10, 15 years. And I think it shows, that our research and, what physicians are doing, that it's making a difference in the public's health.
Yeah, thank you, Jesse. I appreciate your insight and your view on that too. And Erica, I'm reserving I want my comments to jump in between these. I have so much to say, but I don't want to drag out their time. So I want to hear from you all, and then I'll kind of respond at one time. But Erica, I'd love to hear your thoughts on this, and what does this mean to you, and how are you having these conversations?
So I think this is a very timely conversation, especially around breast cancer awareness. I know a lot of times it may seem taboo, a lot of topics around different health issues. And as Jesse mentioned, the word normalize, I love that you used it because I'm always mentioning normalizing conversations around health, because health is something that's so taboo. I as well do serve communities that typically may not be invited to the table for health conversations, or by the time they find out something, it's too late, or the way they believe, what they believe kind of affects how they respond to health things that may occur. So for me, when it comes to having these conversations, it's providing a space and helping nonprofits, helping churches, faith-based organizations, helping organizations, mentoring organizations for young ladies to be aware of these conversations at an early age. So that education is key, because a lot of times by the time they do find out, it's too late. And as we know, early detection is best. So one of the things I get the honor of doing is planning these events. We actually have one this Saturday. One of the mentor organizations that I work with, they're having a women's health fair. So we're highlighting breast cancer. Of course, we're bringing in partners who are able to provide some interactive activity. But while we're there, we're going to address more than just breast cancer. We're going to talk about all of women's health, talking about, fibroids and the menstrual cycle. And to these young ladies at an age where they feel like, or they may not even see the importance of knowing about, testing yourself and screening yourself and checking yourself and what that looks like, what that entails. A lot of times, because they're young, they're not considered like, oh, it's not important. But it's so important, because I myself have had classmates that I was in high school with, classmates that I went to undergraduate with, all within their 30s that have been diagnosed, but they were all early detection, and they're all survivors. And I personally know these women. Like, we went to school together, we went to class together. So to just think, if they were not aware of what to look for, and most of them are in the healthcare space, so they kind of knew a little more. But for those that aren't, or who don't have an advocate, who don't have someone educating them, it can be the difference between, early stage versus stage 4, And so having these conversations at a young age, and just bringing in, speakers, in addition to myself, those who may specifically be working in breast cancer, if it's something more detailed, providing spaces for, circles, for conversations, for focus groups, for just community conversations around it, and allowing these persons, these young ladies, these people at these churches, to know and to be able to talk about their experiences and to share them with others makes a world of a difference. It can be impactful if you may have lost someone to the fight, and so it seems scary. And so because it seems scary, people don't want to talk about it. But we have to normalize the conversation around health, whether it's mental health, because people don't like to talk about that as well. When we talk about major health crises, whether it's a heart attack or a stroke, a lot of times persons in BIPOC communities, those in Black communities, those who are Indigenous, they don't know their history because people are afraid to share it. So being in a space to provide a safe space so that you can share this information, it's important for others to know what's going on in your life, really makes a difference, so that we can help reduce the disparity that we're seeing, where Black women are 40% more likely to have breast cancer, to be diagnosed with breast cancer. So the more work we're doing in the front end of providing education, of being a part of these events, really does make a difference. And I'm just really looking forward to our event this weekend, because it's another part of that conversation. It's an installment of that conversation coming up. And I know it's going to be enriching for the young ladies that are present here.
Thank you, Erica. All of you. I so enjoy hearing from each of you as I'm processing, things that you're saying. And Jesse mentioned something that has me bringing another point here. You said sometimes we can get scared and want to just kind of put our head in the sand and not think about it. And so I want to just kind of add a layer here, because we're all speaking, of course, about how we serve our communities. We have to remember ourselves as public health professionals, because we're not immune to these feelings, the fear, all the things. And I think that when we talk about something like this, it reminds me, I actually had a situation myself where I had a bit of a scare. I went in for a routine mammogram, and then they called me back and we need to do something else. And in that moment, you can forget all the letters behind my name. I was like panicked, and we're not immune to all of the feelings that the people we're serving are, feeling and could be feeling. We just have to, like, Ericka was saying, we have to normalize these conversations around health. And we say this a lot as we have these discussions on the roundtable. It's important. So it's a part of it, being the professionals that we are, serving the communities and the causes we care about. We also have to remember ourselves and remember, almost like put ourselves in the community shoes and remember we're the same, and we have to kind of practice what we're preaching, who is that colleague or friend that you can talk to. And I did. I had my public health friends. I was on my phone, like, I have to go back here. What does this mean? What am I supposed to be doing? And, and they kind of like walked with me through that kind of scary process. And, spoiler alert, I was okay. But, but, just in that moment, it was real. And it was, and I've had that with, we've all had that situation with something related to our health. We'll get a scare or something happens, but just kind of take that, what we teach in these conversations we're having with our community, and maybe even being kind of vulnerable and real with our community. And sometimes in a situation where we can share our own personal experience if we've gone through something. So those things are an important part, but I think all of you had so much great insight to share around that. And it's this kind of resounding theme of the communication and normalizing these conversations are important. Let's just go back one more time. I'd like to give each of you an opportunity to share your final thoughts or any takeaways that you'd like to have before we close out. So we'll pass to you first, LaShonda.
Thank you. Yes, I have thoroughly enjoyed everyone's insight and the work that you're doing. I think as a wrap up, I would just like to say to us and to everyone that is listening to know your body. If something doesn't look right, doesn't feel right, go and get it checked out. Be your own advocate. Be an advocate for yourself. Be a part of your healthcare team. Have these conversations with your doctors and your healthcare professionals. If they aren't listening, it is okay to get a second opinion, but you be an advocate for yourself and you be a part of your own healthcare team. Do your research and make sure you know the statistics. Make sure you know what the risk factors are. And when you go to your doctor for your screenings, for these things, that you have questions that you have prepared to be able to get the answers that you need and feel comfortable with them when you walk out. And if you aren't, ask more questions. Reach out to us. We are all a resource. We all have resources. We are all, if you don't have that, take someone with you. If you are afraid to go with your to your screenings, have a support system with you. So continue the conversations, make sure you're doing your research, and know that you have support and resources in your community available if you need them.
I wanted to say that as a family member, a friend, whoever, be that annoying person that pokes and bugs and says, hey, that doesn't look normal, or hey, you should get that checked out. I had a melanoma on my back. I found out it was melanoma because a friend said, hey, your mole's looking really strange. Like, go get it checked out. And that person could have saved me from it metastasizing to the lymph nodes. And I feel like we get nervous, like, oh, I don't want to like push or scare that person, but it's okay. That's how we can save someone. After my melanoma experience, there was somebody in line in front of me that I didn't even know, but they had a very strange mole that I saw on the neck. And I tapped him on the shoulder and I said, hey, like, it was almost like I was paying it forward, like, just so you know, if it doesn't look normal, you may want to get it checked out. But I feel like we owe that to each other as fellow human beings to, it may seem strange or be uncomfortable, but I think it could save someone's life. And, and just being open to the abnormalities that come with us with living, and how, like we said, to normalize those, and to catch it early, and we can get it figured out, and just and normalize those conversations like we talked about. Yeah, be that annoying friend that pokes.
Yeah, that's great. Yeah. I have a couple of those friends. Did you get your mammogram this year? It's like those reminders in October. That's great. And Ericka, over to you.
Well, as we're wrapping up, I just want to echo what LaShonda and Jesse have already stated. Be aware of the resources locally, be that person for others. I remember a time I had a close friend that I worked with, and just sometimes it can be scary when you receive a message, oh, there's something abnormal. And, it's showing up for other people. So, yes, show up for them. I went with her to get the mammogram. I went with her each step of the way. And sometimes you never know what being that one person for that person needs. You don't know how it impacts them. So, show kindness to everyone, but don't be afraid to just be yourself, to be genuine, and to really have a heart for other people. Because you think about if that were you in that situation, how you'd want others to be there for you. And looking at those who have experienced it, having their village around. It may not have been public knowledge. They may not have shared it until they got through to the other side, but that village is very important. So wherever you are, I know sometimes you want to feel isolated and we don't want others to be around us because of what we have going on, but don't neglect those who are there in your circle, those who have been sent to be a part of your journey in life, even if it's not necessarily breast cancer, but there are people out there for you that are fighting for you and with you, and you don't have to be afraid or feel like you have to go through it alone. So take advantage of the access to the resources that are there, and don't be afraid to share your story, to share what you have going on, because there is someone out there that's willing to be there for you.
That's great. Thank you, Ericka. And thank you all. This has been a great conversation. I'm going to say a conversation starter. I really look forward to others joining us in the comments and sharing. This is Breast Cancer Awareness Month, and we'll move on to a new topic live next month. But this topic should always be priority. You may stumble across this 3 months from now, and it's still a relevant conversation. So I think that I look forward to engage with folks and hearing what others have to say. So thank you all. I absolutely, every time we complete one of these roundtable lives, I'm thinking, oh gosh, this is my favorite. It gets better and better. So make sure that for all of you watching this, make sure our names are on the screen. So follow us, connect with us on LinkedIn. We would love to get to know you and grow our networks. And if you're listening to this on the podcast, then, our names will all be in the show notes or in the description, so you can connect with us on LinkedIn and continue the conversation. So thank you all again, and I will see you next time.
Thank
Bye.
you.